Webinar, we got Chastine Lynch, and we're going to be talking about the Rural Health Transformation Program today, particularly Rural Health Transformation Program Project Management Essentials, how to stay compliant, avoid clawbacks, and get results for your community. So the leap from being proposal stage to shovel-ready proposal is quite steep, and implementing these rural health transformation program grants might get a little bit complicated, particularly if you haven't worked with a grant program on this scale before. So I'm delighted to have Chastine Lynch with us today, based in Palmer, Alaska. Chastine and her team deploy proven agile and project management frameworks to de-risk mission-critical initiatives. Chastine, would you like to introduce yourself?
Yeah, oh my gosh, thanks, Adam. Super excited to be here. As Adam said, I'm born and raised in Alaska, and we operate primarily here out of Alaska. This is our headquarters here. And, we really started with project management and project consulting, and it was a very quick pivot when we started working with clients who needed grants to sustain their projects, to say, oh my gosh, these grants have to have an element of project management in them. And what we often have to do, unfortunately, is come in on the back half of a grant where there hasn't been a project management implementation. And it's now people are out of compliance. They've maybe ruined their ability to get more grants through that funding agency. They maybe even have to pay back some funds because they didn't do things that followed the NOFO, that followed the rules of the grant. And so what we've learned is that project management element is it's so important, especially with this program, the RHTP program, where the funding is going to come out year over year. And you would hate to get approved for year one funding and then not be compliant and miss out on year 2 through 5.
Yeah, 80% of the money gone. So very important to get this right in year one. That's why I wanted to bring you in, because we know as well for government grants, this is different. It's not the same as standard approach to carrying out work. You have to comply, and I want to talk to you a little bit more about how you recommend our audience do that. So would love to start off by asking you, why is project management important, and how would you define good project management when it comes to grants like the Rural Health Transformation Program?
Yeah. I think just in general, there is like a subset of people that think project management is voodoo. We're just doing and saying a bunch of weird things and nothing really comes from it. But what is so important with project management, and especially in the grant space, is identifying objective, achievable goals. And if you are competing for, say, rural healthcare program, now you would have submitted your letter of intent, and you probably know that there wasn't a ton of space to answer these. It was very limited. And so my assumption is, I postulate that there's going to be like a second round where there's more of a deep dive into what you're trying to achieve. And it's so important to identify those objectives that you're going and to have empirical data to report on. And so when you go into these grants, you want to know, what are we going to achieve? You are going to say, we want to make customers happy. Well, happy is subjective. And if you wanted to turn it into an objective metrics, how are you going to report on that? And what are the stages that you are going to check in at? And that's really where I think project management shines in the grant management space.
Okay, so turning fuzzy ideas into actual trackable metrics.
I see a lot like train the community. That is not a good objective. And maybe it's increase staff. Not a good objective. Like, by what percent and by what time Are you going to be like, increase our administrative staff 10% in the first 2 quarters? That is an objective goal that you could hopefully empirically report on. And so when I say empirically, I mean numbers, not statements or feelings.
And how does establishing numbers help you stay compliant but also achieve like real change?
Yeah, so one of the things we see commonly missed is setting up that baseline. So where did you start? And people miss out on setting that baseline, and then you get to a level of improvement, but now you can't report on what the improvement is because you didn't state where you started. And so just those steps along the way that is going to make good data. Make sure that it's something reportable. If it's not a reporting system that you have now, how are you going to report on it in the future? And it's a lot of little things. For example, you might want to baseline your data with maybe an information gathering survey. But structuring that survey's responses are very important. For example, another common mistake I see is text strings. So like, let's say the address is all one text string. That's a very difficult thing to report on if you're looking for just people in Kodiak, because now it's a big text string. So you want to set up your survey to make sure that your city and state have their own space. And even better, if you can have the house number. I don't know if you do up here, if you do your PFD, it always drives me crazy, but I'm like, oh, it's so smart. You have to do your house number and then the direction and then the name of the road. And then if it's a circle or a road or a street, separate all of them. Why? Because that makes the most reportable and filtering. It makes it the easiest and the most accurate.
I love that. I'm from Ireland, and it used to be that every field would have a name to help people, because the world was so much smaller, to help people find stuff. They didn't really have street names and addresses. So it's interesting how Alaska, which is so big, you have to do the same and provide directions.
Yeah, especially here where a lot of people don't have legal addresses. So you have to think up front, how are you going to capture those addresses? Are you going to do lat longs? Are you, how are you going to separate out these non-legal addresses? So a lot of things go in, especially up here, that are very esoteric to Alaska.
Okay. Yeah, I think that's important for anyone looking for this kind of help to find someone like yourself who's in Alaska who understands those intricacies.
Yeah.
So let's say small tribal health consortium has won a grant, and they're thinking about how are we going to do our project management for this to make it successful. Can you tell me, what do you think is the first steps they should take? Should it be a document or something else? And then how do they define their project scope to last the full year of the Rural Health Transformation Grant?
Yeah, I see it happen a lot everywhere. Private, public, tribal, government, all. Where you get into a room and you just assume that the stakeholders, and so a stakeholder is anyone who has a perceived impact into the project. And you just assume that the stakeholders are all on the same page with what is getting delivered. And just as important of stating what is in scope of your project, what is in scope of your grant, is just as important to state what is out of scope. Because you don't want stakeholders, and in this scenario, anyone who has a perceived impact by your project, so that would actually be the funding agency. You don't want the funding agency to have a perceived scope item in your grant or your project that you're not going to deliver. And you don't want your constituents, or you don't want the public, or you don't want the rest of your stakeholders to think they're going to receive something that they're not. And so the first thing we would do is we would do a requirements gathering. We're going to get the primary stakeholders and the decision makers in a room, and really work through what is actually going to be delivered. When is it actually going to be delivering? Who is delivering it? And what are we not delivering? And do some more, chopping down in terms of like, what would we deliver by Q1 and what will we deliver by Q4? And we make what's called a feature or a value roadmap where we can see horizontally and vertically when we're going to deliver what, so that it's a good information radiator and people can just look at it and consume it without having to ask more questions. So those are some of the things that we would do to really increase the transparency of any of our projects, especially with grant funding.
Makes a lot of sense. I was doing a thing on procurement, the procurement requirements of this program earlier, and how important it is to leave a paper trail for all of this. And I suppose if you get audited, like some sort of project management paper trail, like you mentioned, would be helpful too.
Yeah, absolutely. And audits are real, and audits can come for any one reason, and audits are good, right? They're there to be checkpoints. And so if you are crossing your T's and dotting your I's, audits are no problem. To your point, you have the paper trail to supply.
Yeah. And before we move on to metrics, I wanted to ask, you mentioned you've listed on your LinkedIn the Fountain and Agile frameworks. Can you tell us a little bit more about what those are or what frameworks are in general when it comes to project management?
Yeah. So it's an interesting space, I think, especially in Alaska. So Alaska, in a lot of areas, really follow that strict traditional project management. We are currently in PMBOK 8, which is the project management body of knowledge. And since PMBOK 6, which we received PMBOK 7 sometime in 2020, since PMBOK 6, there's been this shift in the way project management should approach project. And the idea is that maybe there's a dichotomy, a line that people draw down the sand to say this is traditional project management and this is agile. And so the difference being that in project, like a traditional old school project management, you would spend a lot of time and a lot of effort gathering all the requirements, all of the scope, all of the contents. And then maybe after months and months of planning, you would start deploying. Whereas with Agile, the concept is you gather a little bit, you get a little bit of an idea, just enough to start developing some value. And then instead of doing what we refer to as a big bang deployment, which is delivering everything all at once, you do incremental deliveries of value. And then again, this is where the agency or the company receiving the funds, they would determine what they consider value to be. But you would incrementally deliver the value. So kind of going back to my first scenario where we do a value roadmap or feature roadmap, where you see increments of value delivered throughout the whole project and not just at the end. And that allows us to kind of shift and pivot if we make a change. Now, this is where it's interesting and why, like in Alaska and certainly in government, you see more of that traditional project management, because guess what? Once you submit your grant application, you don't get to pivot and change. You don't get to pivot and change your deliverables. Those are locked. However, what you can do, let's say training is part of it, is you could do a small training. See how that goes. See who attends. And then work out the bugs before you do a larger training, right? So don't do, a training program that you spend a year and a half planning and then invite 1,000 people to. Do one that you spend 30 days planning and invite 15 people to it. Work through the kinks, work through the bugs, and then continue on.
Okay, so it's about breaking up into whenever you're making your proposal into chunks.
Yes.
Is that a good word?
So you can work. For example, we have a broadband deployment project, And we are deploying to 14 rural villages. And so we said, well, we've been planning, we think we're ready, but let's do the smallest village first. Because when we make mistakes, and we're all human, so we're going to make mistakes. When we make mistakes, the impact is going to be the smallest because we use the smallest village first. And then we know how to adjust as we deploy into the larger areas.
Ah, smart. I like it. Yeah. I think people sort of look down on admin, or they see stuff like this as admin rather than delivery or execution, but this is like the very bottom of the pyramid. It's like the foundations for the rest of it to actually work.
Mm-hmm. And honestly, it's really unfair to put these tasks on just like an admin resource, because the things that I've just talked about have taken me decades of training in college and engagements to get to. It's again, it is esoteric. It's known specifically to project management, all the tips and tricks. And so then when you put it onto, say, like an admin resource that doesn't have this background, you're essentially setting them up to fail, and you're setting your grant up to fail.
Not good. Yeah. Because also we're in like the Doge era, aren't we, of the federal government? And I think they're going to be on the hunt for examples to, pull out for political gain and say, oh,
For
these guys
sure.
in Washington wasted this money to score points.
Yeah.
So,
yeah, no one come for me for the statement I'm about to make. But when Doge was, asking government employees to say, hey, give me 3 things you achieved this week. And I would see, like, on social media, people would be like, oh, I can't believe someone would ask me this. And I just remember thinking, well, I could give you 20 things that I achieved, because you're tracking what you do in project management. And I can give you some real things that were achieved this week. And that's where project management comes in, is those sorts of questions, those sorts of audits, those sorts of, quality checks are easy to do, because you're just like, here you go, I've been tracking it.
Yeah. I love that. So let's go on to metrics. So we've worked with about 75 rural facilities, mostly in our workforce campaigns, and then later in our public awareness communications campaigns, and most of them don't track enough. They're not good for numbers. As you've mentioned, it's left to someone who's juggling a lot of different tasks, or someone on the admin level who hasn't really trained in data analysis. And on the flip side, the minority would track everything, and they end up with data fatigue, and they don't know what to do with all that. So when it comes to this Rural Health Transformation Program or similar grants, could you identify maybe 3 vital signs that every project should be monitoring to ensure they haven't veered off course?
Yeah. I said it earlier, but definitely know where your baseline is. If you're making a statement that you are going to improve something, then you need to know where you started. It's really important to determine. So I see that a lot, where people have these just enormous project management schedules because they've just tracked everything, and that's okay. The converse of not tracking anything is worse, certainly, than tracking a lot. But then how do you organize it? So definitely understand your baseline, understand your goals, and then understand your pillars. So what activities, let's say again, let's say you're a lucky SOB and you win all six categories in your grant. So you've got healthy beginnings, healthcare access, healthy communities, fiscal sustainability, strengthen workforce, and spark technology and innovation. Let's say you write just a humdinger of a grant and you win all those funds. And you're going to want to be able to track what activities and what efforts went into each one of those pillars. And then in addition to that, you want to make sure that you understand your budget line items and which one of those budget line items roll into which one of those pillars. And you don't want to be tracking something outside of your budget line item. You don't want to make up your own space because it isn't part of the budget. And so anyways, understanding your baseline, understanding your goals, and then understanding your categories where effort and costs are going to get rolled up into.
Okay. And that really simplifies it. I mean, you can really
sounds simple when I'm saying it, right? Like, oh yeah. But then where do you start? And how do you do it? And how do you make sure that you're staying on track and that there's someone actually focused on this program? Okay. And honestly, there is a very, very generous, in my opinion, 10% admin fee associated with these grants. And it would be the most responsible for the companies that receive, or the organizations that receive these funds, that admin cost go towards managing your grants. I see it so often that is not the case, that your admin fees don't go towards managing your grants, and then stuff gets missed.
Well, let's talk a little bit about personnel then. What would you recommend, given that this is going to be year one? Realistically, they'll have like 9-10 months to complete it after they've done all their contracts and planning. Do you recommend they hire someone on a short contract? Do they outsource to someone like yourself, or what helps them decide which route to take when it comes to staffing?
Yeah, so there's going to be some nuances depending on how you wrote your RFP. So for example, if you wrote, your grant, if you wrote your grant, say with Upskilled, then we're your project managers. If you didn't write your grant with a project management company as like a partner that you're going into the grant for, you're more than likely, I'm going to say more than likely, high probability, but maybe there's a caveat out there you want to double check, but you're going to have to go to competitive bid. And you're going to want to make sure you do competitive bid correctly. Now you can hire a company to manage your competitive bid. But essentially what I'm stating is you need to post an RFP, a request for proposal, that companies can bid on. And there's a whole process in that. You usually have to have it up for 30 days. You need to be able to answer Q&As. You need to show, reasonable provisions for the people who apply, and so on and so forth. And so those are really the two approaches you're going to want to take in terms of partnering with a company to help manage your grant.
Okay. And is that easier? What are the benefits of doing that instead of hiring someone on in-house to work on it?
So there's a lot of benefit to, say, partnering with a company. So for example, like what we do is we partner with companies all the time and say, hey, we're going to write your grant. We're going to go into this grant with you. We're like a known subcontractor on the grant, and then we're part of the grant, so we don't have to go into competitive bid. But when then these people want to do competitive bid for other aspects, so we're doing the grant management, the project management, so you go to competitive bid because you want to replace your point of sale, and you can't just hire anyone. There's rules and regulations. Then we could do all the competitive bid work for you, and then there's the whole competitive bid process. So that's the benefit of really going. I mean, let's say you're doing recruiting and you go in with Adam. Adam then is your recruiter, and you don't have to go to competitive bid for that. So that's the benefit of going in as like a subcontractor, contractor, or prime subcontractor relationship into these grants.
Okay. So identifying that
does allow that.
Yeah, identifying before you do your formal application, then you have to do the. Okay.
Yeah.
That makes a lot of sense.
Yeah.
When it comes to risk, then, is there any hidden risks that you think leaders overlook until it's too late?
There's always hidden risk. There's hidden risk I will overlook. There's the known unknown, and then there's the unknown unknown. The most important thing about running into risk is understanding your thresholds and your mitigation plan. So essentially, how do we escalate this? How do we work through it? If you run into a risk that's going to halt your project and you spend 30 days trying to figure out the mitigation for it, well, those are some valuable time. But if you understand, hey, going into this project, here's the escalation process, here's how we handle issues, here's how we're going to approach risk when they come up, and then you don't have to spend that 30 days planning that while the risk is happening. So going into the start of your project with an understanding of how do we respond to risk, what is our risk threshold, what's our appetite for risk. There's lots of different approaches to risk between, accepting or mitigation or transferring. Transferring is a really great one, and we do this a lot, where we say, okay, we're going to deliver these features, we're going to deliver these values in the grant, but oh my gosh, now we've got this risk list stacked up with all these complications we can run into. But what if we transfer that scope and say, we're going to have a vendor do this? And now the vendor owns the risk. We don't care. You're going to deliver and we're going to write you a check. We transfer the risk to you, the vendor. So that's what's so important about risk mitigation.
But if the vendor messes up, is it not the awardee of the grant gets in trouble, or would they just pass on?
I'm talking more like hiring people. So let's say you have to hire, 10 pass-throughs for 2 years or for a year. There's a lot of risk in hiring 10 people that you're going to keep on for a year that aren't really part of your organization. Well, instead of having them be my own employees, I'm just going to transfer that. And I'm going to go hire a company that can give me those 10 people, and I write them a check for it.
Yeah.
Risk is now transferred. Okay. So yeah, absolutely. If the vendor doesn't perform, then at the end of the day, you're on the hook, which is why the competitive bid process is so important. And the grant management and the project management is so important to make sure your vendors are delivering what they're supposed to be delivering. So they all kind of tie into each other.
Yeah. No, I'm seeing a lot of advantages on the staffing part, at least. So, which brings me on to another risk that we have found. So we worked with the Colorado Office of eHealth Innovation, and they're trying to make healthcare more digital, increase interconnectivity, etc. And they commissioned this survey in the western part of the state, 6 counties, and the survey found that over half of people that didn't have access to telehealth wouldn't use telehealth if they had access to it. So there's a lot of trust barriers about data security and quality of care, that even if a big telehealth investment had been made in the area without some kind of public awareness or change in attitudes and beliefs, half the people wouldn't have been keen on using it. So with these large scale, particularly tech implementations, I'm thinking internally there might be a bit of fear of change and issues that need to be managed. How do you think project managers can think around that and manage that human fear of change?
Yeah, there's a whole process, like a whole pillar dedicated to change management for that exact reason, because you have to approach the change. And remember, a stakeholder is anyone with a perceived impact by your project. So they might not be impacted by your project, but that doesn't mean they're not perceiving your project as an impact, good or bad. Obviously, if it's a good impact, you want to capitalize on that. If it's bad, you want to address it, because yes, there will always be a level of sabotaging in terms of accepting the change if you don't get out in front and make those change management practices viable for your stakeholders. And then you get a much higher adoption rate. That has been tested over and over and over again. Your adoption rate is significantly higher when you apply to really any type of scope. When you apply change management. Why? Because your stakeholders now feel like they have a buy-in, like they've had a say, they had a word, and now it's their word, so they want it to work. But if you didn't, manage the change up front, you're going to get to that deployment and they're going to go, well, I didn't like this. I don't like it. This isn't what I wanted. No one asked me. And that's just kind of human nature, right? So change management, very important piece.
Getting people involved is so important too.
Early.
Yeah.
Get their early adoption. Yeah, absolutely.
And if thinking on the Rural Health Transformation Program, let's say we're speaking on Alaska, letters of interest are being sent. Would you recommend people do that now and say, here's what our letter of interest was, or wait until to see if they've won a grant? What stage do you do that?
That's an interesting question. And this is going to be, I would say, definitely a preference for whomever is running the grant. But for me, you might want to maybe reach out and see, hey, who would be interested? Who would be my stakeholder? But you want to be careful of making any statements of promise, right? Because you might have submitted your letter of interest and you might feel like it's a really strong letter, but you don't know what kind of changes you might end up seeing if it gets approved. Whether your proposed partnership changes, because the state of Alaska has stated that, like, hey, we're not going to approve, no one from the lower 48 on a standalone grant is going to win this money. And we're not necessarily going to approve every partnership because we might be able to partner you with someone better. So I would not make statements of promise around the grant until it was approved and in my hand. But good to start reaching out to your constituents, to your demographics, to see what is your interest in this. And then that will kind of help open that doorway of communication, especially with like tribal communities. Rightfully so, they're very guarded. And you want to make sure you have a trusted partner, trusted entity doing communication with the tribal entities.
Okay. Yeah, I see what you mean, because you don't want to make people afraid something's going to happen, and then it doesn't happen, and there's a lot of misspent worrying.
Or promise that you're going to do something that doesn't happen, and that will ruin your, your reputation for trust. To say we're going to bring 30 new jobs to this town, but then you don't get the funding, and now you're only going to bring 10.
Yeah.
Right out the gate, what you said was a lie, not on purpose, but a lie nonetheless. And so that's why I wouldn't make statements of promise.
I think that's about accountability, isn't it? It's staying accountable to what you promise you're going to do. If we look across organizations, when milestones are missed, often it's a breakdown in communication. Someone returns the work late, doesn't get around to it, many things. So we'd love to know from you, how do you recommend awardees and rural healthcare providers build a culture of accountability without it feeling like a culture of blame?
Yeah, I think one of the easiest ways to do that is with an information. Someone, I might be having a stroke. Information radiators. And those can be really simple. To me, data should be one of two things. It should be easily consumed or easily reportable. And what do I mean by that is, if you just give like a giant spreadsheet of numbers and the intention is for people to look at it and consume the data, that doesn't do any good. You want to roll that up, and you want to make clear statements of empirical data, like goal, hire 30 employees, current state, 3 employees hired, and just like have those easy block numbers as an information radiator, and just be able to disseminate that out And that increases the visibility. It's easy to use. It's easy for people to consume. And just really, and sometimes it's the hardest thing. And we kind of like us data nerds in the background joke about this all the time, how hard it is to take a ton of data and then make it one number.
Yeah.
Because you want to make tons of statements, right? But you want to actually just, as like a data person, you want to make all these statements with all the data that you have, but really you need to keep it simple and clear and crisp and easily consumed.
And accessible as well. It's,
yeah, accessible.
So I want to know then, we're going to be closing it off here, building on that. So we've gone over how you need to keep data accessible and simple. You need to make everyone sure what the goals are and actually have numbers instead of just feelings or ideas. And thank you so much for sharing all this. I'm going to apply it in my own projects as well. And we have a couple of organizations that have applied to us that applied with us to the program in Alaska that I'm thinking of. And part of it is about building something with grant money that should be financially sustainable at the end of the first year, ideally, but over the 5 years at least. After the grant program's over, this should still be about. So from a project management perspective, is there any structures that we can build so that things don't just collapse whenever the grant money ends?
Yeah, I mean, I don't know that there's any one structure that I would say make sure you do this, as much as I would say make your baseline your current state, and then I idealize what your future state is. Where are you going to go with that? And then once you have your future state, you should be, from a business, looking at that to say, well, how do we sustain that? Now with this grant, things, like bringing on more employees, like it's going to feel like you need more employees, but do you have the revenue to support those paychecks? And you can bring on a new point of sale, but do you have the revenue to support that month over month subscription fee once the grant ends? All right, so thinking along those lines, and when you do idealize your future state, then you can go, okay, how do we sustain this? How do we sustain this? What's the cost of business to do this? And really go down and in the beginning, have some sort of plan to continue on with your programs before you commit to them being your deliverables. Now, what will be nice is I think a lot of year one, which kind of rolls into year two, will be everyone getting up and going. And so you're going to see a smaller return in terms of, because the projects are just going. And successful projects will be able to apply for additional funds for year two. And at that point, you're going to see a much larger ramp up, right? Because things are up and running and you can really see those numbers. So at least we are going to have a little bit of an agile approach in the beginning, because it will take a while to increase productivity. And so at the end of year one, we can go, oh, you know what? That worked, but that didn't. So let's make that change to our grant application.
Yeah. Okay, so it's about learning as you go. I mean,
yes.
Updating things, and that's what the agility comes into it.
Yep.
It's better. Yep. I did do the you call it PMBOK?
PMBOK?
PMBOK. I call it PM. I did do that, and you're right. There's like hundreds of pages in the PDF I had with the course, and it can get a little bit.
Oh, it's as exciting to read as VHS installation instructions. Like,
yeah,
it's dry.
Yeah. Well, to close then, could you tell us a little more about what it's like operating your company out of Palmer, Alaska? Is there any logistical hurdles, and just tell us more about your experience, really, in rural healthcare and rural work.
Yeah, in the beginning, when we launched in kind of started dipping our toe into consulting in 2021, people tell them I'm from Alaska, and they'd be like, "Oh, do you live in igloos? Do you have power? Do you have internet?" Luckily, at that point throughout my career, I had come across lots of what became future clients for me, so they knew my quality of work, and I could just kind of like jump right in there. But now remote work is so common, it's so relevant. Relevant. It's so relevant that it's a point of interest for me to be like, "Oh, I'm in Alaska," and then people have lots of questions, but no one ever is like, "Oh, you can't do the work because you're from Alaska." But there's a couple of things like consultants. Here's your PSA for today: is don't restrict yourself to those man-made confines called time. If you want to work remote, then if you've got a 4 a.m. meeting, then your day starts at 4 a.m. And if you have an 8 p.m. meeting, then it ends at 8. Like, don't restrict yourself if you really want to be able to go out there and get clients in the lower 48 and have an Alaska. For me, I got to live the most amazing lifestyle being here in Alaska. It's just every single day is waking up to a dream come true. And I get to work with people from around the country because we are flexible and we don't restrict ourselves to the nonsense concept of time.
Okay. Interesting. Yeah, I've recognized that working with people in Alaska, that they get up earlier than a lot of others in the lower 48, or some of them stay up later, and really admire that. And it's part of the resilience, isn't it? And
we're sturdy. We're a sturdy bunch up here.
Yeah, love that. Well, if people want to learn more about project management, it comes to your whole transformation, or learn more about you and your company, where can they find you?
Oh gosh, well, you can find us on LinkedIn, and then also at upskilledtalent.com.
Great. Thank you so much, Chastine. It's been good to have you on. If anybody wants to connect with me, we're helping Rural Health Transformation Program applicants and awardees 5x the impact of the programs through public awareness, outreach, marketing, recruitment marketing, and you can connect me on LinkedIn, Adam Chambers. I'm sure I've probably sent you a million messages already, because we are quite busy on LinkedIn at the moment. And tune in. There'll probably be another one of these next week, so I hope you can join us then. And do reach out to Chastine. She's really the expert in this, and I hope that you have a great day. Thanks, Chastine.
Thank you. Bye now.